Hello, my name is Mindy Sims. I am a registered nurse on the Board of Development for the DRHA CVA Survivors Education and Wellness Clinic. I am here to speak to you today regarding care coordination for CVA survivors. At the conclusion of this presentation, team members of the CVA Survivor Education and Wellness Clinic will be able to identify the population at risk, including CVA pathophysiology and comorbid conditions, identify typical symptoms associated with a CVA, critical assessment findings, and the interpretation of laboratory and diagnostic data, collaborate with an interdisciplinary care team regarding the health promotion and risk reduction of the CVA survivor population, and identify goals of care to achieve holistic health and wellness. CVA is the third leading cause of death in the United States. Stroke is the leading cause of serious long-term disability in the United States. Most CVAs occur in people over the age of 65, but they do not discriminate. They occur in people of any age. CVA death rates are higher for African Americans than for whites, and the risk of an ischemic stroke doubles in current smokers. In addition, our CVA population suffers from multiple comorbidities, including hypertension, diabetes, hypercholesterolemia, high triglycerides, obesity, and many are current smokers or have had a history of smoking. Goals of care are in line with national standards of care for CVA patients. These include that the patient is educated on and complies with prescribed medication regimen, patient achieves a relatively pain-free state through medicinal and complementary alternative medicine, the patient is able to perform activities of daily living, able to recognize signs and symptoms of a recurring stroke, the patient remains in a state of holistic wellness, mind, body, and spirit, and the patient seeks out assistance and support for feelings of grief, anxiety, and depression. And finally, the patient is able to achieve a state of mental and physical quality of life. At the CVA Survivor Education and Wellness Clinic, we provide secondary management of care. We want to ensure that the patient does not experience a recurrent stroke and is able to achieve the utmost quality of life. For health promotion and risk reduction, Healthy People 2020 initiative to improve cardiovascular health and quality of life was implemented. They are going to do this through the prevention, detection, and treatment of risk factors for heart attack and stroke, the early identification and treatment of heart attacks and strokes, and through the prevention of repeat cardiovascular events. In addition, the World Health Organization reports that decreasing the risk of cardiovascular disease by improving cardiovascular health will decrease the risk and incidence of CVA in this population. Goals for health promotion are to manage comorbidities, implement smoking cessation programs, decrease obesity through promotion of healthy lifestyles by diet and exercise, and maintain consistent pharmacologic interventions as well as complementary alternative therapies. Two different types of stroke occur in patients, ischemic and hemorrhagic. The pathophysiology of an ischemic stroke may be caused by a thrombosis, embolus, or systemic hypoperfusion. Ischemia causes brain damage by activating the ischemic cascade. The ischemic cascade happens when oxygen and glucose are depleted, thus causing failure of energy compounds. These compounds, such as ATP, initiate the energy-dependent processes. When those energy-dependent processes cease, tissue cell death occurs. The extent of damage depends on the duration, severity, and location of ischemia. So you can see in figure A, a blockage. That blockage, when you look down at B, has now resulted in a lack of blood flow to the blue area, and depending on the duration and that location, we will have some cell death. A hemorrhagic stroke occurs due to a rupture of blood vessels in the brain. Harmful effects include hypoxia due to disrupted vascular supply, irritant effects of released blood on the brain parenchyma and vasculature, and raised intracranial pressure due to continued bleeding, which may further restrict cerebral blood flow. Hemorrhagic strokes are more dangerous than ischemic strokes, and there are two types: intracerebral and subarachnoid. And you can see in figure A the weakened, diseased blood vessel that has ruptured, and you can see in figure B the blood that has begun filling the space inside of the brain. Typical symptoms of a stroke include sudden numbness or weakness on one side of the body or face, sudden confusion, difficulty speaking, slurred speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance, or lack of coordination, and a sudden severe headache with no known cause, often described by patients as the worst headache of their life. The key word sudden here is really important. Patients report that everything came on very suddenly. It was not a gradual headache, it was a sudden severe headache. All of a sudden they were talking and could not, communicate effectively. Assessment findings. We have this FAST acronym, and that is going to let us as healthcare providers know that we need to act quickly, but it's also going to give us guidance on what we're assessing in a very quick manner. F for face, ask the person to smile. Does one side of the face droop? A for arms, ask the person to raise both arms. Does one arm drift downward? S for speech, ask the person to repeat a simple phrase. Is their speech slurred or strange? And T is for time, ask the person when the onset of symptoms occurred. And it's also T, time for us, so that we can act in a very time-efficient manner. Next area of assessment includes a complete neuro exam, a holistic assessment, and the National Institute of Health Stroke Scale. This NIHSS, it may be referred to, needs to be complete by a neurologist or a doctor if a neurologist is not in the building. As for laboratory and diagnostic data, baseline labs such as a CBC, a BMP, PT, PTT, and INR are going to be assessed when the patient walks in the emergency department. We're going to be able to see a baseline of their complete blood count, see if any electrolytes are off. We're also going to be able to monitor for clotting or hemorrhaging. To diagnose a CVA, though, we are going to look at the diagnostic tests of an MRI or a CT scan. And current research suggests that MRI results are more conclusive than CT results when compared. So this is new data as of about 2010. And you can see in the figure on the right, it is an MRI scan of the brain, and the white area is the area of ischemia. Holistic therapies are going to include pharmacologic and non-pharmacologic therapies. Of the pharmacologic therapies, we are going to be not only treating the stroke itself, but treating the patient for any existing comorbidities that they may have. The patient may be placed on antithrombotics, antiplatelets, anti-diabetic medication, antihypertensives, anti-anxiolytics, antidepressants, anti-hyperlipidemics, analgesics, sedatives, or laxatives. A lot of times laxatives are included in this pharmacologic therapy due to polypharmacy that we have created with all of the other medications. Non-pharmacologic interventions are going to occur in the rehabilitation phase. Patients may experience anxiety, depression, pain. They may experience a decreased quality in life, and we want to combat all of that. So through non-pharmacologic activities such as yoga, CVA survivors benefit in multiple areas for rehabilitation. Yoga aids in improving balance, quality of life, aids in reducing the fear of falling, and provides better independence with daily activities of living. Yoga also lowers blood pressure, heart rate, and provides cardiopulmonary endurance. This complementary alternative medicine aids in promoting whole body, mind, and spiritual wellness, increasing sleep, decreasing anxiety and depression through the release of endorphins, as well as meditation and breathing. Next, meditation and relaxation. Techniques are indicated for this population due to their ability to provide a lower heart rate and blood pressure, decrease stress and anxiety, increased holistic quality of life, and provides spiritual and mental healing, soothes pain, and evokes a feeling of pleasure and relaxation. Aromatherapy is indicated due to its positive effects, promoting relaxation, enhanced mood, decreased anxiety and depression, sleep promotion, and enhances holistic healing and quality of life. Massage therapy has been proven effective in the rehabilitation of a stroke. When conducted 2 times a week for 6 weeks, muscle spasticity was reduced, pain was reduced, and a decrease in anxiety, depression, and an enhanced quality of life was seen. And finally, with acupuncture, research suggests that acupuncture has positive effects on the digestive, nervous, and cardiovascular, endocrine, and immune systems, can promote healing, decrease pain, and improve sleep. Acupuncture is indicated for this population based on the need for an increased sense of well-being and enhanced quality of life. Through collaborative interprofessional care, CVA survivors will be able to recognize the signs and symptoms of a recurring stroke and know the necessary steps to prevent the recurrence, achieve a relatively pain-free state of living, perform activities of daily living independently or with the assistance of a caregiver. They'll be able to seek out support through holistic complementary alternative medicine for feelings of grief, anxiety, and depression, and they are able to regain a state of emotional, spiritual, and physical wellness. In conclusion, the patient population of the CVA survivors is a vulnerable population that requires the care of a multidisciplinary care team and effective transitions of care across the health continuum. Patients who are learning to live with the new diagnosis of CVA survivor are faced with many challenges, including the introduction of new medications, polypharmacy, increased levels of stress, an alteration in lifestyle, and a potential decrease in their perceived quality of life. With the addition of pharmacologic and non-pharmacologic therapeutics, patients may be able to regain control of their lives through holistic wellness and the promotion of healing. Through patient-centered, individualized care, CVA survivors can meet the expected outcomes discussed in this presentation. As a healthcare team here at the CVA Survivor Education and Wellness Clinic, we can positively impact the lives of stroke patients, providing support and secondary preventative treatment, individualized to meet each patient's needs, resulting in a life of quality, free of recurrent CVAs. I have also attached a Fast Facts handout for each of you, and it also will include a link to this presentation if you would like to re-watch. Thank you.